Is there translation in the room? Not in here. So if someone's in here and they don't speak French, they won't understand. Oh. Okay. So, are you going to announce that at the beginning? Would you make that announcement to the room? Okay. Okay. Est-ce que mon sac est juste mon sac est là?
Login here.
Ah, c'est ça.
Voilà.
Juste prendre le numéro.
Ce qu'elle a dit, c'est que
Email.
la situation avec la traduction, c'est qu'il n'y aura pas la traduction dans la salle. C'est sûr, c'est en ligne. Alors, les participants sur la salle peuvent, avec leur téléphone, ça va être compliqué, choisir la session, cliquer sur anglais ou quelque chose comme ça. Je ne sais pas. C'est ce qu'on a dit. Je pense qu'on doit expliquer cette situation. Mais je ne sais pas comment ça fonctionne.
Moi non plus.
Elle a dit qu'elle ne peut pas
So you don't have
aussi
space here.
expliquer.
Bon, peut-être qu'elle peut expliquer.
Can you hold for me so I can read the link off? Okay. Admin.
Non, moi, quand je les ai vus, là, j'étais rassurée.
Je pensais que ça.
Je pensais que
Oui,
c'était
oui,
des
c'est des traducteurs simultanés. Oui. C'est bizarre alors. Oui. Hmm. On a même pas. Oui. C'est pas possible, c'est pas bon. J'ai vu ça aussi. Alors, c'est possible qu'on n'aura pas beaucoup de
Oui,
personnes.
moi, je me suis rendu compte de ça hier.
On a
Ça,
beaucoup
c'est pas
travaillé
normal.
sur ça,
Oui.
c'est pas bon.
C'est pas juste.
Ce n'est pas juste.
C'est pas juste.
C'est comme ils n'ont même pas fait un effort.
Exactement.
C'était comme.
C'est exactement.
Ça ne pas. Oui, ça s'est passé. C'est dommage. C'est vraiment dommage.
Une session francophone, tu mobilises tout le monde.
Oui,
Toutes
c'est
les
ça.
sessions.
Oui, c'est
C'est
ça.
sûr que les gens vont être stressés.
Oui, oui, oui. Je dis, on n'a pas intérêt à DU. Ça, c'est notre. Oui, c'est ça. Oh,
C'est exactement ça.
oh c'est dommage.
I don't know my password. Sorry about it. That's okay.
Oui.
On espère quoi
C'est ça. C'était pour cela qu'on a eu cette idée-là.
Okay.
Et je savais
So
que
now Peach Pattaya
ça peut
3.
être une opportunité.
So now.
Mais maintenant, si tu prends tous les francophones, tu leur donnes la même. Moi, c'est hier que je m'en suis rendu compte. Moi, je
Oui,
vérifiais l'heure.
quelqu'un ce matin m'a dit que est-ce que tu as vu que ce sont tous à la même
Moi, c'est
heure?
quand je vérifiais la
Ouais.
session.
Oh, see, we're
Je
not
vois,
on the
en fait, je me suis
we're
rendu
not on the right
compte.
section.
14h40. J'ai dit
Quoi? C'est l'heure des francophones.
oui.
So then
Et c'est
basically
tout.
this will show on there.
You get the francophone hour.
Comme si on a voulu
Ok.
tous nous mettre
Tous
dans
le
un
même,
paquet.
oui, c'est pas
Tous dans le même
paquet. Oui,
paquet. Voilà.
c'est comme c'est quelque chose de spécial.
C'est bon.
Oui,
Oh
vous
là
avez
là.
l'heure francophone. Vous devez être content.
When this
On a
song
fait ça.
shows,
Oh, c'est dommage.
C'est
Pas
vraiment
tu.
dommage.
Oh.
Avec tout ce
Oui, j'ai
temps,
vu sur le WhatsApp, j'ai vu qu'il y a
Oui.
d'autres concurrences. J'ai vu
Tout
que
le monde est fort.
Oui, oui,
venez
oui.
nombreux.
Oh non, venez ici.
Alors, quand il y a des jeunes à côté, c'est vrai que la concurrence.
Ah
n'est
oui,
pas-
oui, oui. Ah, est-ce qu'il y a
Ça
une
devient
association avec les
difficile.
jeunes?
yeah.
Enfin, je sais que
So there's just
FHI,
one slide
Knowledge
at the
Success,
beginning,
Okay.
and
avec
one slide
Aïssatou,
at
elle a
the
quelque chose
very
avec
end.
les jeunes.
So, okay.
Il y a des sessions, hein?
Oui, oui.
If you want, I will
Oh là là, on peut rien faire.
Mais non, malheureusement,
c'est fait.
c'est fait, voilà.
C'est fait, c'est fait.
On va voir ce que ça va donner.
Oh là là, ça doit être la délégation Madagascar.
Oui, je pense.
Yeah.
Et c'est dommage pour eux, parce que ça, c'est une chance de présenter leur expérience.
Oui.
Personne n'est là.
Oui.
So do I need to be
eux, ils connaissent déjà.
Okay, tell me what's happening. You know what, Kelly? We're just gonna it'll just be a little funky. Do you mind doing that?
That's fine if you guys are okay.
No, we're fine. Kelly's gonna have to help. Elle doit nous aider avec le Slido.
Oui.
Et elle a dit
Speakers are gonna
que
speak here, right?
non, non, ça va marcher, mais elle doit le faire là-bas. Mais toi, tu vas rester là,
Oui,
n'est-ce
moi,
pas?
je vais
Alors, ça ne va
rester
pas
là.
passer le
Oh, so
prochain.
they're gonna speak at their seat.
Yeah, so we're actually gonna speak up here, but you can just do the slides. Yeah, I think so. Yeah, that's what we decided. We're gonna speak here. She's gonna stay here, the moderator. So you could be there for the slides.
Crawling under.
No, she'll be here
Pas
because the
rester.
Slido is during the beginning. So Fatima is here. You can be
Yeah.
here. You can be here, and then when Anne,
Very end.
Yeah.
come in and like just Anne will step aside. Okay, fine. And it's a casual cut. It's cool. Oui,
Oh,
on
allemand?
peut voir oralement.
Oui.
Old-fashioned way.
Yeah.
Yeah, no worries. I'm
Yeah.
really not stressed about it. I'm more stressed that all the francophone sessions are. Fatih and I were just talking. Ce n'est pas juste.
C'est pas juste.
On a beaucoup travaillé.
Oui.
Okay, maybe there's 1,000
Ouais,
people.
espérons.
Espérons. Are you there, francophone? Oui, les 1000 francophones qui ne sont pas là.
Actually, I don't need a chair. Can I just sit?
Est-ce que j'ai vu que madame, est-ce que c'est Mariam qui était à la ministre de la Santé au Sénégal?
Mariam.
Oui, Mariam, elle était chargée du PF il y a 5
Oui,
ans.
oui, c'est la même.
Est-ce qu'elle est là?
Elle est là.
Oh, je l'ai vue ce matin, mais c'est Mariam, n'est-ce pas?
C'est elle, Mariam
Ok.
Viviane.
Est-ce qu'elle est toujours avec le ministère?
Oui. Elle est toujours à la division pays.
Ok,
C'est elle le chef de la division
ok.
pays.
Je vais dire
And
bonjour.
then I
la
want
prochaine
to
fois.
see the results. I need to see this slide first, and then I want to see the results after
Um,
everyone's done.
After everyone done. So
Yeah.
if you want like that, you have to be signal to us.
Yeah. Okay. Okay, that works. Okay, thank you.
Mais maintenant, pour les participants en ligne,
Uh-huh.
est-ce qu'il y a un moyen, il n'y a pas de moyen d'interaction finalement avec eux? Sinon,
Oui,
pas
c'est
la
ça.
possibilité de poser des questions. Donc, ils vont juste
Non, ils ont
écouter,
dit
en
que,
fait.
oui, c'est ça.
Ils ont
C'est
dit
comme
que-
la télévision. C'est tout. Ooh, that would be so nice if there were like a fan blowing right in my face. Wait, c'est comme la télévision. Hi, so glad you came to our session. Thanks. Everyone's here. Jill, all the francophone sessions are at the same time. Mhm. We just figured it out this morning. But Jill, there's no translation in the room, so don't try and get people who don't speak French. Ashley, do you speak French? Okay, well you'll understand me because I'm going to speak in French and you'll understand me. But we can stop and take questions and. Okay, well then you'll understand hopefully. Yeah, the slide should help. Est-ce que tu penses que ça vaut, tu dois mentionner qu'on n'a pas la traduction dans la salle?
Ah, parce qu'il y a beaucoup
Sinon-
qui ne sont pas francophones.
Bon, je pense qu'il y en a. Ashley a dit. Mais elle a l'intérêt
À écouter, oui.
Bon, est-ce que tu peux dire
Les questions sont en
arrêter pour
français.
donner
Je ne sais pas si...
Oui. Et à ce
Ça peut
moment
être
aussi,
plus
bon,
informel.
quelqu'un va aider. Quelqu'un va
Oui,
aider.
oui, c'est quand même un oui,
Ah,
oui, je peux
dans la
l'aider.
salle?
Oui, 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 on peut faire comme ça.
Dans la salle. Oui,
Comme ça, c'est un peu plus informel. Et pour les gens qui sont venus. Les gars.
Voilà. Voilà, donc s'il y a des questions en anglais, tu peux traduire pour les panélistes.
Oui, oui, oui.
Ok, bon, on va essayer de trouver des solutions.
Oui, on va trouver une solution. On doit être créatif,
On va
n'est-ce pas?
trouver, il y a-
Oui.
on va essayer.
Francia.
Demander s'il y a des participants qui demandent des questions en anglais. Est-ce que je peux traduire les...
Oui, oui, je peux traduire aussi. Oui, on a juste dit ça. We were just talking
Ah,
about it.
d'accord.
Yeah, I
Okay.
can do it or you can do it. Sure.
Tu es mieux.
Okay. Voilà.
Oui. Oui, oui, non. Alors, on attend un peu.
On attend un peu.
Comment tu me dis?
OK, on attend un peu.
Oui. On a le temps. On va attendre
Hello,
peut-être
my
que
dear.
mon-
Hi, Jenna. Have you met Fatu? Oh, good.
Yeah.
Yeah.
Oh, yeah.
Oh, it's gonna happen. That's all I can say. It's gonna be fine. Yeah.
He will go to the
What's that?
booth tomorrow.
Ça ira.
Ça ira.
Le temps va passer.
Ça ira, Inch'Allah.
Inch'Allah. Inch'Allah. Inch'Allah. Okay, we'll see. And Fatu, do you have the clicker?
Non?
Le chose, le truc qui avance.
Une nouvelle collègue. Ah. À partir d'ici. Hein?
OK.
Mais ils nous ont donné le machin. On va se lever et aller là-bas, mais
Okay.
on va aller.
Well, they did the first one. Yeah. We're not going to start just yet.
Tu veux le truc? S'il y a un truc, on peut peut-être assis.
And also, all the francophone sessions are at the same time. All the francophone sessions are at the same time.
Vraiment, c'est pas intelligent.
C'est pas intelligent. C'était plus facile.
Pour eux.
vois?
Moi, non, moi, je crois. Parce qu'en fait, le problème, c'est que.
Yeah.
Yeah.
Donc, est-ce qu'on va se lever et parler d'ici ou on va rester
Oui,
assis?
non, on va parler d'ici. C'est elle qui va
C'est que moi,
Après, moi, je
vais
prendre le
rester
clicker
ici
et
parce
je
que
vais laisser le clicker là.
j'ai
Parce
besoin de...
qu'on peut aussi présenter directement.
Oui,
là,
je pense
éviter les
que
va-et-vient.
c'est possible aussi.
Mais il faut juste passer le clicker.
Oui.
Ok. Mais
Comme ça,
vous êtes à
I'm a
côté,
trip
vous
coming
faites,
over.
vous faites comme
Comme on veut.
oui, pour nous, c'était plus simple.
Oui.
Okay,
Oui.
sure, sure. That's
Parce
fine.
que la salle, elle n'est pas très grande. Je pense
Oui,
qu'on peut...
c'est ça, c'est pas très grand. c'est ça.
Bien, on va nous passer le clicker et on peut
Je pense que c'est un shoot live.
Oui,
On va
c'est déjà.
faire attention.
Comme la dame disait.
Attention. Attention.
La dame, elle a dit.
Okay, okay.
Moi, je fais comme ça. Je suis à l'aise à être assise.
The delegation listens
Ah. Pas les autres pays, mais bon.
Ouais, ça marche, c'est allumé.
Yeah, we all know. On va faire avec.
Bonjour à tous. C'est juste pour vous informer qu'on va commencer dans quelques minutes. Merci.
C'est ça. No, we've got karaoke. On commence? Ok, on commence. C'est bon? Allez.
Rebonjour à tous et merci pour l'intérêt porté à cette session. J'ai vraiment l'honneur et le plaisir de modérer cette session avec vous.
For the interest that you show in this session, it's a pleasure to moderate this session to present a new contraceptive method that is that all through the first experience with DIU in Madagascar. First of all, I would like to tackle this opportunity to thank Medicine 360 and the representatives of the government of Madagascar to invite us to this event. My name is Fatou Vintumbo. I'm the representative of the country. I am based in Dakar. We During this session, we will have with us Dr. Mo Vololonia, which is the Chief Service in the Ministry of Health in Madagascar. We also will have with us Dr. Francia, which is the program manager for efficient contraception. We also have with us Anne Pizzer, sorry for the translation, the pronunciation, which is the director for family planning for Momentum Country and Global Leadership at GH Piego. And we also have Margot Fanestock, which is the vice president of strategic development at Medicines 360. So that's it. The speakers will present some fields, the next fields, the results of our pilot with the private sector and the contribution to the introduction of the product at the national level and the escalation and the introduction to the public sector. The strategic for the introduction of DAU, hormonal DAU at Madagascar, and which are the lessons that we have learned as copper DAU and some other injectables. The differences between DAU, hormonal DAU, and other methods, and how this difference have an effect on this strategy of introduction, and also the plans of the ministry for to have the hormonal DAU and how the introduction of these products has been done in the in the FP 2030 plan. In this slide, we will have an idea of the evolution of the introduction at a big scale of hormonal DIU of PF 2030 for the first time. What we can say is that the system DIU, which liberates progesterone, which is a EUD, hormonal DOE, it's like a contraceptive measure which is really efficient, and it's at with, it is present on the high revenue countries from more than 20 years. But none of the countries of FP 2030 has disposed of this measure because of the cost of this product. This method is now on the list of the model of WHO drugs, and in 2018, with financement, some NGO launched a project to evaluate the demand and the demand in Kenya, in Madagascar, in Nigeria, and Zambia and Zimbabwe. And 2021, so this result and other factors contribute to the decision to add this IUD to the catalog. Before I start with our panelists, we will make a small exercise through Slido, and for this we will ask our colleague Kelly to help us. We would like to have your questions, your answers through to a couple of questions that Kelly is going to explain now. So you have to scan this QR code. So, as far as I know, you could see you should be able to see the first question, which is in which country do you work? Everybody answer to the first question? No, not yet. Okay. What do you want to learn during this session? Which are your expectations? Can you see the second question? Kelly, can we have an idea of which are the answers?
And in order to answer the need of women in Madagascar and to raise the use of contraceptive, they have introduced Avibla for the first time in the social marketing sector. These are plans for the public sector. And the first time it was in the social marketing sector. You have the two ambassadors promoting the product. It was in a French mall. It was a strategy of Percy Madagascar in order to speak about the benefits of Avibela. And among the three partners, we registered Avibela with the medicine agency in Madagascar. Also, 8 providers were formed. We've also used the results of the clinical trials with non-contraceptive benefits. And you will be explained the signification, the meaning. So thanks a lot for your attention, and I'm looking forward to your questions and comments. Thanks a lot, Margot. Thank you for this presentation that allows the different participants to know more about this new method. And as you said before, now we will listen to Dr. Francia, who is a program management for PSI Madagascar, the hormone DU protocol from health agent in the social franchise between 2006 and 2009. Doctor, you've got the floor. Dear public, good morning. It's a huge honor for me to be part of this panel today. And this is the result for the pilot introduction, a hormonal project implemented by PSI Madagascar under the high supervision of the Public Health Ministry. Why hormonal DIU is a method often used in Madagascar. Today's presentation will be organized in 5 steps. First, the family planning context in Madagascar. Then we'll have an overview of the program characteristics, methodologies, private health training. Then we'll have a look at the results. And at the end of my presentation, we will see together the conclusion and the political commitment following the results. According to the results of the study of 2021 in Madagascar, 31% of partnered women use modern contraceptive, but the mix of methods is not balanced because self-injection can reach 62% of use, then implants 22%, and the intrauterine contraceptive method with 2%, and 15% of the needs are not met, in particular in urban areas. Now let's speak about program characteristics. The hormonal DIU was introduced under the brand of Avibela in coordination with the Public Health Ministry. 6 regions were covered among the 23 in Madagascar. Training was provided and a very high quality service in Avibela, 22 private health centers in a network of social franchise, and 7 private hospitals out of the network. We also work with 3 reference hospitals led by gynecologists. We've got women who are brand ambassadors. They send key messages promoting Avibela beyond the contraceptive benefits. Still speaking about the programs, let's speak about prices. In order to cover partially the costs and to have a sustainable program and product, we decided to cover partially the costs with Eco Cars, PSI Madagascar used to buy 1 unit from the provider for $13, and the unit is sold for $15. For the providers on the ground, and then the client can buy the whole service for $30, and after 1 year the different partners agreed on a cost, and for each step the price is revised. Medicine 360 revised the price to $9 per unit, and then the private partners could buy 2 units with deliverable examination for $15 each 2 units. As a consequence, the clients could have access to Avibela for a reduced price of $15. And DSI Madagascar provides free days for young people and low-income women, and they can also get Avibela injected for free during private health training. In 2019, a cross-cutting study about Avibela's users with the objective of understanding the way it is used. The study was carried out among 242 women. 151 completed their study in 3 months, using at least Avibela for 3 months. What are the results? We can see that 82% of users are educated at the secondary level or higher. Very interesting for our country because 30% of users of Avibela are less than 25 years old. And it is particularly important to understand that young people make 30% of the people in Madagascar. 79% of users are married or live with a partner, and 95% of users have already used a contraceptive method at a moment before choosing Avibela, and they decided to give up the method for the following reasons. Mainly for having heavy bleeding, spotting or irregular bleeding, fear of infertility, headaches or other side effects, difficult to use or absence of bleeding. And afterwards, when we asked them why they switched to Avibela, the main 4 reasons: effectiveness very high, reaching more than 45% among the answers given by the users. That is the duration, 6 years, very useful for them. The side effects are more manageable, so the users feel very free in their daily lives. And also the bleeding profile, menstruation, that are more comfortable when the user has to carry out daily life. And when they are asked what method you would have chosen, what method you would have chosen if hormonal DIU wouldn't have been available, 39% said they would have postponed or used a traditional method or no method. They would have postponed the date of the visit. So the contraceptive benefit or non-contraceptive benefit led to a very high using rate. 80% of the users that they're very, almost 90% of the users said they're very satisfied or satisfied by using this product. So, conclusion, the introduction phase in the framework of private health training has influenced an introduction phase for the public health training sessions. This action was efficiently coordinated and supported by the Health Ministry and helped introducing the upscaling, national upscaling of hormonal DIU. Thanks to the scaling up, the hormonal product that is private, that has to be paid for, and the second channel, public health training aimed at low-income women, that is free, and very recently, since July 2022, third channel for providing a community channel through mobile hospitals. The project is supported by SIAD. And this concludes my presentation. Thanks a lot, Dr. Francia, for this presentation. So you have already anticipated the way the results of this experiment have been used by the public sector, and now we will listen to Dr. Vololonia, who will let us know about the commitment of the public sector. Dr. Vololonia, who is head of service for riskless motherhood and family planning, director of family planning at the Ministry of Public Health. Thank you, Fatou. Ladies and gentlemen, good morning.
De Madagascar, le professeur André Manatanzeli Harvey.
We won't get this 60% if we don't find a strategy to meet this gap and to arrive to this objective, to 2030 objective. Within our strategies, we have to wide to extend our contraceptive products. Which are the contraceptive methods that have been used by women at Madagascar? This has been presented by our colleague. I won't repeat what it has been said, but I would like to mention that the EUD it's at the 4th place in Madagascar. Regarding the EU hormonal IUD in Madagascar in 2018, within the label Avibela, we have now the LG, the label LG from ICA Foundation, and now we have the Milena, which is at our at Sara, which is which is which is available at Mirena. Avibela and Mirena are on the market in Madagascar and on the national list of fundamental medicaments. We can find this coverage in 5 regions and in 3 hospitals when we can train 3 gynecologists. We finance this project. It was co-financed by CHAI with the public sector. And all these projects could finance the training of the providers and also the material for the insertion, the material for communication during these training sessions for all the collaborators and all the actors. Thanks for the technical support and leadership of the Ministry of Health of Madagascar. This evaluation of introduction phase was made in 2021, and we decided that we could create after this elaboration, this implementation, 3 years implementation from now to 2024. After the introduction phase with the public sector, we made 772 introductions or insertions between July 2021 and June 2022. We want to distribute more units of these hormonal DUU during the next years. For the public sector, the objective that we marked was to make 71 training session at the Hudel level to be a reference for the hormonal IUD and to cover 37 districts over 114. For the private sector, we have a scale-up plan. We from April 22 to March 23, we want to deliver 82 training sessions in all the country. Same thing for the private sector. We make the provisions to distribute 4,000 IUDs in this last part. Madagascar wants to work with the public sector and the private sector. These two things are to show you the data that has been collected regarding the insertion that has been realized with the public sector. As you can see here, we started with 25, and the number of insertions is now between 300 and more than within the private sector. All the data is collected monthly because we just started in 2021. So the number of monthly insertion is over 100. But in December, we show a reduction because we had a supply problem at the country, which now has been resolved, and we get all this kind of we get we had some Mirena that are now available at Salam. What are available at the purchasing office. We have now a plan for the introduction of this display, and the hormonal IUD it's integrated in the quantification of the national strategy and in the national information system of health information, and is also integrated in our curricula. Ladies and gentlemen, in conclusion,
Kenya and Zambia also have scaling up plans, and I think I think you've been convinced by the fact that the design works. For the last awareness, counseling of providers and other channels for demand, and this is where in our experiments we use what already exists at the community level. We didn't organize campaigns as beautiful, as fantastic as the ones organized in Madagascar. So take into account in your campaigns this product, and advise. I insist on a very good mentoring and follow-up system. Don't forget to use other awareness raising channels. Think of the benefits of this method. They're very interesting. Keeping in mind that it's always good to align creation of introduction plan and scaling up plan allows the different actors to be aligned and coordinated, and I think it's a very good thing. In Kenya, we even had a practice community with other actors such as NGO, Jacaranda, Sunshine. So we had a group that had worked before it was formalized in the national system. There is always need for more coordination, and at the access group level worldwide, you have to understand that the a bit challenging at the beginning issue, what are the expectations regarding the volume of stocks, and I draw conclusions with our experiments with implants where all the forecasts were proved wrong. The forecasts were always wrong. We had discontinuation of stocks. So when we understood one lesson, that small studies with our direct clients are more reliable, and I know that our colleagues of PSI, among others, are working on a method, on an approach that is more practical, whether it is the public sector among an NGO. Please get in touch with someone at info@hormonal IUD. And I want to thank my student. Thanks a lot, Anne.
Il ne nous reste plus beaucoup de temps pour les questions et réponses.
Much time for the intervention, but anyway, we're going to try to take a couple of questions from the audience to give you the opportunity to react and to express your opinion on this presentation. Before giving you the floor, I would like to take a couple of minutes to share some reflections. I think you will agree with me that we have different contraceptive methods and that they are necessary to answer to different needs of women and men at the different stages of their lives. The introduction of new contraceptive methods to enhance the choice on the market can contribute to the efforts to answer to the willing of the individuals to the along the lives. We have to be aligned on the rights that can have a high impact in family planning plans. Today, we had the opportunity to share the experience of Madagascar with the introduction of hormonal the IUD. Personally, what I get after this presentation that I found complementary between them is that the introduction of new methods can last can take a long time regarding different contexts, but now we see different elements that are the cause of success of these implementation initiatives of new contraceptive methods. And I also have to say that we need coordination of the introduction of these new methods. We need planification and coordination thanks to national leadership, the evaluation of the market, the integration of the on the uh, and the follow and the monitoring and the evaluation of the process. So I would like to say that we have reaction. You may have reaction following this presentation. So if you have questions, we are at your entire disposal. Thank you. So we didn't have the text that has been written. Do we have questions on? Thank you. My name is Coffee. I I am the FENIA representative in Madagascar. I would like to thank the presentation that have been done by the panelists, and we show that we have the opportunity to expand the different contraceptive methods everywhere, and particularly in Madagascar. The question that I would like to ask is for Medicines 360. I would like to know outside the production of this contraceptive method, do you want to deploy this contraceptive? I mean, are you, uh, are you supporting the implementation of this method on the ground? I mean, for example, if the Ministry of Health of the private sector is willing to introduce this new method, are you supporting this process or not? This is the first question. And the second question is for the contraception that are not on the list that of contraceptives that are given by UNFPA. You said that these contraceptives we can always get them. They are not on the list of the contraceptives that we give to the 56 countries that are in the partnership of the UNFPA. But anyway, they are always available. So if one country, regarding the discussion that we have with the Ministry of Health, if the Ministry of Health uh, needs these kind of measures, we can add a new contraceptive method to the quantities that has been received by the country. And just for information, I would like to tell you that young people, if you have actions regarding the youth, to give them to give them access to the contraceptive methods in Madagascar. In the frame of of this program, we have the support of Norway to make some family planning for youth. We have a financement for 3 years until 2025 to to support the family planning for the young people. And this is going to be in addition that all that has been made in Madagascar. Thank you. Thank you. Thanks for your question. We give the floor to Margot. Thank you. I think that we also have a question for Medicine 360, and after that, a couple of comments. Yes, regarding the support, I thought it was the question, which was the support that we can offer you uh, for Medicine 360. Our staff, it's of 40 people. We are based at the US, and our work system is with in partnership. Most of the time, we choose some partners that work on the private sectors, and we try to offer them training. We have a trainer. We work and we also make some. I mean, we are at a central level to train with a method, but we are open to new discussions, to new ideas. If you have something in mind, we can discuss of the situation, for example, in Madagascar. If you have identified any needs on the ground that has not been identified by the central level. I don't know if you have anything in mind, but you can of course share what are you thinking about. Most of the time, it's us that are offering this training session. We are offering a training session, and after that, our partners on the ground and the Ministry of Health will create a partner on social marketing, and it will be them that will do the implementation on the ground. But if you have anything on, in mind, we are of course open. As I mentioned, Madagascar it was our first country with this Avibela experience, and we are committed. We remain committed, even if it was a success for the country. If there is any other thing to do, we of course are committed to help you. Anyway, you will have the opportunity to follow the discussion regarding this question. And do you want to add anything? No, I would like only to thank Coffee for this point of the opportunities that the UNFP, because UNFP is offering option and different option to the countries to receive products, and for the NGOs, if some of you are working with NGOs, we can work with the NGO Foundation. I have to tell you these products are offered for freely. I don't know if you have any other questions on the. No more questions, no more comments. Any contribution? I I would like to say that we have to recognize that FAT2, representing FAT2 Population Council and Population Council, were the one who invented the hormonal IUD. So it's really interesting to have a FATU on this panel. Thank you for this comment. It was a pleasure to participate in this panel with you. This regarding the private sector, you know that in the private sector, the cost of access to contraceptive methods uh, uh, are subsidized. This is for the public sector, but in the private sector, you have to pay for them. My question is, do you manage and do you manage to have clients? I mean, do you have clients? And if you have clients, can we not consider that it's a kind of elite contraceptive method? Because in Madagascar, in terms of the capacity of people to pay, it's something sometimes hard to get. Is there a possibility to find institution that could eventually finance or reduce the cost and expand the access for other people of this contraception. If you want to pass from the contraceptive prevalence from 43 to 60, we have to grant the opportunity to all the people to have access to this method, even if they don't have the money. We give the floor to Madagascar team that will try to answer in a minute.
Donc, commencer